Overview of managed care and Medicaid changes. Iowa HealthLink is now the name for the Iowa Medicaid Managed Care Program. Iowa is launching a new program effective March 1st called Iowa HealthLink. The original start date was January 1st, but CMS has delayed this launch. Letters were mailed to patients on December 24, 2015 to explain the extension to March 1st. The Iowa HealthLink program aims to bring together all services such as physical health care, behavioral health care, and long-term care under one program. The vast majority of current Medicaid patients will be provided care under this new program. Programs that will not be included in the Iowa HealthLink program are the Program of All-Inclusive Care for the Elderly, or PACE. They may opt in, Medicare Savings Program only, and the medical needy. Undocumented persons eligible for short-term emergency services only and presumptive eligibility. Medicaid will continue to provide dental benefits for pregnant women and children, and adults will continue to be covered through the Dental Wellness Plan. The HIP program, which is a premium assistance program offered through Medicaid where members do not receive Medicaid services. What is a managed care organization, or an MCO? A managed care organization is a health plan that coordinates care for a member. The MCO is a private entity, like other insurance companies, and is paid from the state of Iowa to coordinate. In January and February, Iowa Medicaid members will continue to receive services as they did previously. Members will receive coverage from Iowa Medicaid between January 1st and February 29, 2016. Beginning, members will receive coverage from their chosen managed care organization, or MCO. All Hawkeye members were transferred to United Healthcare. 75% of Hawkeye members were participating in Wellmark in 2015. These members will have the opportunity to switch to AmeriGroup or AmeriHealth by selecting an MCO prior to February 17th for the March 1st start date, or they can decide to stay with United Healthcare. Members should ensure that they have updated their address changes with the Department of Human Services and should watch their mail for MCO member enrollment letters, which include their MCO card and primary care provider, or PCP, selections. WellCare is no longer an option through Iowa HealthLink program. Members who were assigned to WellCare will be reassigned to one of the 3 MCOs and will be receiving a letter for reassignment. We've reviewed what members should do in January and February. What should providers do in January and February? Providers will bill Iowa Medicaid Enterprise through the fee-for-service model. Programs such as Meridian and Magellan are effective after January 1st. After March 1st, providers should proceed with the new MCO pay cuts. The Iowa HealthLink program is designed to bring all member services under one program. To achieve this, 3 managed care organizations have been named. They are the AmeriGroup Iowa Incorporated, AmeriHealth Caritas Iowa Incorporated, and United Healthcare Plan of the River Valley Incorporated. Please note that WellCare is no longer an option as of December 18, 2015. For members, all benefits will remain the same. What is unique is that each MCO company can offer value-added services, which are additional incentives that a member may receive by choosing that company. If members feel they have not received appropriate care or get a bill in the mail they believe should have been paid, they can contact an advocate through the Managed Care Ombudsman's Office. The Department of Human Services will continue to determine eligibility when a member applies, and the application process will stay the same. Members will continue to receive a card once they are determined eligible for services. Applications are still available online, over the phone, and on paper. Any questions may be directed to Iowa Medicaid Member Services. What is the correct date for how long members can see providers outside of the MCO network and receive 100% reimbursement, and then 90%? Out-of-network providers will receive full in-network reimbursement until March 31st, 2016. After that, out-of-network providers will receive 90% reimbursement rates indefinitely. The 90% out-of-network rate applies to the out-of-state providers as well, unless the MCO and the provider come to a single case agreement, in which case the MCO may pay more. If a member's provider is not included in their MCO's network and they see the provider after March 31st, 2016, will the provider be paid? If not, will the member be forced to pay out of pocket? The member will never be forced to pay out of pocket for a Medicaid provider. The provider may accept the 90% out-of-network rate from the MCO or refuse to see the patient. If a member of Iowa HealthLink sees a provider who is a registered fee-for-service provider with IME, but not signed with any MCO and not willing to work with the MCOs, will the state pay? No, the state will not pay. The provider may accept the 90% out-of-network rate from the member's MCO or refuse to see the member. A provider who knowingly treats a Medicaid member cannot bill the member for the rate difference of services rendered. If a Medicaid provider refuses to accept the out-of-network rate, they cannot bill the patient directly. Can patients be billed from providers who are not participating with the MCOs or Medicaid? Yes. The provider must notify the member that they will pay out of pocket prior to services, or the provider may refuse to see the patient. Members will be auto-assigned to an MCO. They will have until February 17, 2016 to select their MCO to go into effect on March 1st, 2016. This is pending approval from the Centers for Medicare and Medicaid Services. Members also have until May 18th to change their MCO for any reason. After May 18th, patients will need good cause to change their MCO. An example of a good cause is if a patient provider is not enrolled with an MCO. Please note that depending on when a member switches, it may take more than a month for the change to go into effect. There are several ways you can learn more about Medicaid program changes. Contact information for email alerts about Medicaid modernization and the Iowa HealthLink website are shown here. The next set of slides will check your understanding on the information we've already covered. True or false? Lifelong Links is the name of the new grant launching March 1st. True or false? CARE program members will be included in the changes to managed care. True or false? Hawkeye members will be included in the changes to managed care. True or false? The MCO is operated by the state of Iowa. True or false? WellCare is one of the managed care organizations. True or false? Benefits will stay the same under the managed care model. True or false? DHS will continue to manage Medicaid applications and determine eligibility. True or false? Once assigned, patients are not able to change MCOs. There are several key factors that members should consider when selecting their MCO. Are their providers part of the MCO network? Are their pharmacies part of the MCO network? Are their healthcare specialists part of the MCO network? Does the MCO have any value-added services or health programs that are beneficial? Or does the MCO have member support available to fit their needs, such as a 24/7 call center or language support? Good morning. Thank you for calling Dr. Provider's office. How may I help you?
Hi, I keep hearing about Medicaid changing, and I want to make sure I still have the coverage to come see the doctor.
Well, we appreciate that you thought to call us. You're not alone with your question. This has been a very confusing time with the recent changes that have been made to the Medicaid program. My first question is this. Are you a part of the HIP program?
Yes, I am.
Oh, that's great. You don't have to do anything at this time because the HIP program was not included in the Medicaid changes. Your coverage and benefits are not changing. Is there anything else I can help you with today?
No, that's all I needed. Thank you.
Okay, great. Well, thanks for calling. Bye. Good morning. Thank you for calling Dr. Provider's office. How may I help you?
Hi, I keep hearing about Medicaid changing, and I want to make sure I still have the coverage to come see the doctor.
Well, we appreciate that you thought to give us a call. You're not alone with your questions. This has been a confusing time with the recent changes being made to the Medicaid program. The first question I have is this. Are you a part of the HIP program?
No, I have never heard of that program. I am pretty sure I have Medicaid.
Okay. Have you received anything in the mail? Enrollment packets have already been mailed to members.
But I didn't get anything in the mail.
Okay, that's not a problem. I think the best thing we can do is to have you call the Iowa Medicaid Member Services right away. That number is 1-800-338-8366 and ask about which MCO will be best for you. They can tell you which MCO you are assigned to. If that isn't the best choice for you, they could help you make a change. What is important for you to remember is that if you want to continue to see your regular doctor, the one you go to most, you want to make sure that doctor participates or is in network for the MCO you choose. It's been kind of a busy time, so if you receive a busy signal, just call again. A representative will help guide you through that process. That number again is 1-800-338-8366.
Okay, I think I can try to do that today. So after I pick my managed care organization, my doctor appointments will be covered?
Yes, and if you want to continue to receive care here, we are participating with MCOX and MCOY.
Okay, I really like seeing my doctor, and I want to make sure I can keep coming for appointments.
Thanks again for calling. Be sure to let us know if you need any other help.
I appreciate your help. Thank you.
Bye. Good morning. How may I help you?
Hi, I heard I need to make a change to my Medicaid, and I need to know which plan to pick.
Well, we can't say which organization is best for you to choose, but each managed care organization provides the same benefits because they must provide the same benefits as you receive from Medicaid. Some of the things you want to think about in making your choice are whether or not your providers, like your doctors or pharmacies, are part of the MCO network you choose. Or each managed care also has value-added services. These are perks and special programming that you can receive by choosing a particular company. These value-added services are listed in the enrollment packet for Medicaid. You can also contact the MCOs to find out more about their value-added services, such as a 24/7 call center or the language line.
So if I want to continue coming to see you, I need to know which MCOs you're working with?
That's right. We are participating in the network of MCOY and MCOZ.
Okay, that helps. I still feel confused, but it sounds like I have a better idea of the MCOs I need to look at if I want to keep seeing you.
Yes, this is sure a big change, but it's pretty normal to feel confused. Is there anything else I can help you with today?
No, I think I know where to start now. Thank you so much for helping.
You're welcome. Stop by again if we can help you with anything else.
Thank you.
Bye.
Guidelines for providers. All healthcare providers delivering services to Iowa's Medicaid population who are included in the Iowa HealthLink transition to managed care are welcome to inform their patients of the Iowa HealthLink plan in which they have chosen to participate. However, there are strict prohibitions against patient steering, which all providers must observe. Providers may inform their patients of all health plans in which they participate. Providers are not allowed to selectively disclose the health plans in which they participate. Disclosure of health plan participation must be all or nothing. Providers can display signage provided by the health plan at their location indicating which health plans they accept. However, signage must include all health plans in which they participate. If a provider participates in only one Iowa HealthLink health plan, the provider can display signage for only one health plan and can tell a patient that that is the only health plan accepted by that provider. Providers may not recommend one health plan over another and may not offer patients an incentive for selecting one health plan over another. Providers may not assist patients in the selection of a specific health plan. Additionally, patients may not use the provider's fax, office phone, computer, or similar equipment to make such a selection. Under no circumstances is a provider allowed to change a member's health plan for him or her or request a health plan reassignment on the member's behalf. Members who need assistance with their health plan selection should contact Iowa Medicaid Member Services. The materials with this presentation include a handout entitled, What I Need to Know. This handout has been created to assist members in understanding the important role of the PCP under managed care. Welcome packets, mailed by March 1st, will include member cards and a welcome letter. An additional packet will follow that includes the member handbook and additional member information. Members should be aware that they will be auto-assigned to a PCP. The PCP will be listed on the front of the card. Members should be aware of their PCP assignment and understand that they are able to make a change to another provider as needed. Checking insurance IDs. Each patient receiving Medicaid will present 2 IDs. the MCO identification card, and Medicaid identification card. When checking eligibility on the IME website, eligibility and patients' MCOs will be indicated on the IME website. The IME website will not provide the patient's MCO identification number. When checking eligibility and ensuring PCP, each MCO has a provider contact number to call. Use these numbers to ensure eligibility and to ensure that a primary care physician has been assigned and who that physician is. The following slides provide general information and key contact information for AmeriGroup. This information is also available in handout form in the materials that are provided with this presentation. The following slides provide general information and key contact information for AmeriHealth Caritas. This information is also available in handout form in the materials that are provided with this presentation. The following slides provide general information and key contact information for United Healthcare. This information is also available in handout form in the materials that are provided with this presentation. The next slides will check your understanding on the information we've already covered. True or false? Patients need to bring only their Medicaid card to appointments. True or false? The IME website will indicate eligibility. True or false? The IME website will not provide the patient's MCO identification number. True or false? Patients can be told which MCO they should pick by a case manager, provider, or other healthcare staff. True or false? Patients who have not received an MCO card are not able to seek care.